Welcome back, everybody. I am Matt Menashes again, the Executive Director of NGS, and I am the moderator for Panel 2. And I'd like to just briefly mention who we have on our panel, and they'll introduce themselves. But Krista Cowan, the Corporate Genealogist for Ancestry and the Barefoot Genealogist. Ellen Goodwin, who is the Chief Solutions Officer at Artifacts. Debbie Gertler, who is the Assistant Director of everybody's first or second favorite library. It depends upon whether Kurt Witcher, the director of the ACPL Family History Center, either your first or second favorite library, and David Rencher, the Chief Genealogical Officer for Family Search, the President of NGS, and the former head of either your first or second favorite library. All right, so we are going to ask a few questions of our panel. We're going to move through quite a few questions because this group really is going to begin to make the segue between our healthcare panel and our Society, Library, Archive, and Museum panel that's coming up later, though all of these folks are very familiar with SLAMs, as we call them, and could speak expertly themselves. But they're going to try and draw some connections between what we heard on the first panel and what we're going to hear on the third. So the first thing I'm going to ask them to do in just 30 seconds each after they introduce themselves is to reflect on what they've heard in the first panel. So we'll start and move down this way. We'll start with Ellen, and if you introduce yourself and just reflect on that first panel.
Sure. Hi, everyone. As you said, Ellen Goodwin. I'm the co-founder and Chief Solutions Officer at Artifacts and based out of Austin, Texas. So I'm sorry for everyone else who had a 3:30 wake-up call. The first panel, one of the things that really struck me, and it's, I think, a theme that we'll all be touching on, is the connection component. And this is something that we've focused on really early on at Artifacts. But the reality is that what connection look like, it changes, right? And I have a mother living with dementia and how we engage. And I think that when they talk about getting up with purpose, that's something that is how we actually find people willing to engage with technology, is because they have a motivation to do so. It might be intrinsic to themselves. It might be a family member that brings it to them. But I think that for us, when we're talking about how we're engaging in the family history and family stories, I think that that theme really resonated with me from the first panel.
Chris?
Krista Cowan. I'm the corporate genealogist at Ancestry. I've been doing that for about 21 years and built a career on the concept of resilience. And many of you are probably familiar with the Emory University study about resilience in children who come from homes with strong family narratives. And so I just find so much interesting parallels between that. I love what Dr. Ye said about that age brings resilience. And so I'm now super curious if we've already built that resilience inherently in our children and been intentional about that, is there maybe more resilience later in life if we've laid that foundation from the beginning, and the connections between that and family history and family storytelling.
Fantastic. Kurt?
I'm Kurt Witcher. I'm Director of Special Collections at the Allen County Public Library. And I think David and I, Family Search Library and the Allen County Public Library, we're just right there for everybody. So it's really all good.
Co-opetition.
Yes, there you go. There you go. So really humbled and honored to be here. I am so glad and so appreciative of Vivid Pics and NGS and Family Search for recording this. I will be listening to that first session over and over and over again. So much information, wisdom, experience there. I come at this from a number of different angles. I've played in the genealogy space for more than 4 decades. Yes, I started when I was 5, but that's okay. And I'm also walking that journey with my mother, who is in an elder care, memory care facility right now. And she's, I could have used some of this information like 2 or 3 years ago, but I tend to, or I'm going to act on some of that. And it's just very, very enlightening. And I think the genealogy space, the family history space, I believe this for years, has a huge role to play. And it's so neat to see these organizations, these national organizations coming together to find solutions and to share data and to gather more data so we have even better solutions. So I'm really excited about it. I can tell you that elder care facility activity directories are hungry for all of this, are hungry for what was in the first panel. We had an open house at our library just a few weeks ago. There were like 6 of them that wanted to get in their car this morning and drive to Louisville from Fort Wayne because it's only 3.5 hours because they wanted to be here in person. So there's a hunger for giving dignity and aging well, thriving, if you will. So humbled and honored to be here.
Debbie?
Thanks. I am Debbie Gertler. I'm the Assistant Director of the Family Search Library. I've been there since 2011. I am also the daughter of 2 aging parents. My dad has a very similar story to Joe Biden. He had prostate cancer. He's now in the throes of bone cancer, and he's doing quite well, all things considered. He has one of those lovely devices that they spoke about earlier that he puts on when he watches TV, and he can hear TV with it, and he loves it. And so, I have seen times when he has not had his hearing aids and how that has impacted, like he's feeling like he's part of the conversation. My mom texted me earlier this week. She's finally decided she needs hearing aids. Yay! So I'm excited, but I have noticed as my parents have gotten older, they're more likely to want to share their stories with me. And so I have been pouncing on that because I want to know their story. I want to pass that on to my children and to my grandchildren because their lives matter. And so I think family history is something that's very important for our aging community because we're all going to be there someday, and they have stories. Their world is so different than ours now that we need to share that.
David?
Thank you. I'm David Rencher. I've been at Family Search for 45 years now and love it. I am the oldest I've ever been today. What I took away from the first panel was completely opposite from what I thought I would get. And that is they were telling me that loss of hearing was a negative, and I was feeling like it was a blessing. I've worked with the man who's now the director of the Family History Library, and we talk about a culture and an environment, and not a day went by when he was my assistant director that he didn't make an age joke directed toward me. And it was just kind of funny. It was just something we did, right? And you have to understand that I don't consider myself old. I just turned 72, and I just don't. Age is just a number. I just don't even think about it. 3 years ago, I was assigned to a 10-year project, so my retirement has been delayed some. You can do the math, and I'm having the time of my life. And so things from the first panel so resonated about staying active and doing things and purpose and sense of purpose and getting up every day. I mean, I have to pinch myself. I'm having so much fun in my career right now that I can't think of doing anything else. And so to me, that keeps me young. And I just, I feel like if people do have purpose and a reason to get up, that they behave completely differently and they think completely differently. And it has a very positive impact on their health. And so I just see a lot of corollary between what the first panel discussed and some of my experience in family history that we'll share with you throughout the panel discussion here.
Well, we didn't set this up, but David, the thought about purpose is actually the segue into our next series of questions, which really is on daily purpose and volunteering and mental engagement. And I'll start with you just to expand on that a little bit. How have you seen family history work give seniors a sense of purpose and a reason to engage with the world every day?
So over my career, I've had a number of different opportunities. At one point, I was over what we called extraction at the time. It's family search indexing is what it really was. But we assigned various groups to index or extract names from specific records. And I noticed one of the groups that we visited, we go out and visit these groups all the time. And I was visiting a group in Cedar City, Utah, who met every day in the basement of the tabernacle there to index. And we, at the time, we were talking about moving to online internet indexing. And we thought, this is just the best thing that could possibly happen. This is going to be great. And it just fell flat with this group. It was a complete negative because their whole purpose for getting up every day was to come to the center and to associate one with another. They had a potluck every day. Everybody brought, something. They'd work all morning. They'd have their potluck lunch, and then they'd go home and do whatever for the rest of the day. But the thought that we were going to take that from them was so negative that it just gave me pause. And yet, technology moved on. And yes, we did move to an online environment, but I felt for those people because I could see that was their social interaction and their need for just getting up in the morning and being with each other. The other point, in 1984, we launched Personal Ancestral File. And in 1985, I was asked to speak to the Dallas Genealogical Society. I was there in the Dallas Public Library. And of course, desktop software had just started. I mean, we are just barely starting to use this stuff. I'm still, hanging on to my wide carriage IBM Select typewriter. I'm like kicking and screaming going to desktop software. But I asked the audience, there were probably 300 people in the audience, our demographic. And I was just curious, and so I asked how many of you are using, online software and have gotten a computer and doing that, expecting maybe 24 hands to go up. Almost every hand went up. Our demographic accepted and took to technology, in my mind, faster than the demographic at large. They saw the advantage to what they were going to be able to do, that they wouldn't have to retype a family group sheet every time they wanted to make a change, and that they could work with that. And so they pushed themselves. And I think it's something that with family history right now we're just starting to get into AI, and others will talk about it, I'm sure, but every new technology that helps family history, our group seems to adopt immediately and move forward. And I think that's a significant factor when we look at how family history might be able to help in the aging process. Our group accepts and moves with technology, I think, as faster than any other group for our demographic.
David, thanks. Debbie, just turning the same thought of the purpose and engagement that people experience every day when you walk into the library. There are missionaries on that first floor who are engaged in talking to people from around the world who just either stumbled into the library or, like all of you, purposefully went to the library. But the technology on the first floor and the missionaries' engagement with people from the public who have just wandered in. Can you tell me, you know these volunteers, you know them well. Is there a personal story you can tell me about one of them and the engagement experience that they have in connecting people to their family history?
Sure. Thanks, Matt. Great question. So first of all, to let you know, we have probably about 400 missionaries, senior missionaries who serve in our library, so that we have a big crew and we do a lot of training. And you would think that most of these people have gone through their careers, they've done all their education, they're ready to be done. That is not the case. They are very eager to learn. They come in very excited to learn. And so we have this pin system. As they pass up a level, they get a pin. They just love it. It's like Cub Scouts all over again. As a former den mother. But they just love the people that come in. I mean, they pull them in, they talk to them, they get them starting to talk about their family, they learn about them, they ask them questions, they're totally engaged. And it's not even their own story, they're listening to their stories. And I think that is what gives them purpose. I'm an Arizona girl, we don't have great winters in Utah in my mind, but they're there, rain or shine, snow or ice, they're there because they know they want to help people get engaged. We had a sister that came from Arizona, and she was terrified of the computer. But this is one of our missionary volunteers, and by the time she left 2 years later, she was going to town. So she had totally adopted the technology. She was able to grasp it. She was able to do what she wanted, and she even advanced in more training that she really didn't need to take, but it was related to her family. She was serving in the US-Canada area. Her family was from Scandinavia, so she took the Scandinavian training because she wanted to be able to continue her engagement in family history. And every day we hear stories of missionary interactions with guests who come, as Matt mentioned. Some of them just wander in off the street, and they just get so engaged. They love what they do. The missionaries have such great experiences, and our reviews show that, because when you read our reviews online, oh, I had such a great experience. The volunteers there were awesome. If you're in Salt Lake for any amount of time at all, you've got to stop into the library because it's so wonderful. And the bulk of our work in the library is done by these seniors, and without them, we would not be able to function. So they recognize their purpose. They're willing to do the skills and the training that's necessary so that they can give the best help and help everybody to have a great experience and love family history as much as they love family history.
Well, while we love our paid librarians, Kurt, I'm going to ask this question about volunteers at ACPL as much as Debbie and David have talked about volunteers at the Family Search Library. So you've probably observed, not only in the context of the library, but every genealogical society in America that you seem to be a member of. You've probably observed some of the things that lead to emotional and cognitive benefits for older adults through volunteerism. What have you seen as in your many varied roles?
Well, thank you for that question, Matt. So I could take the rest of the hour, but won't, because there's a lot of wisdom up here. Not for me. So resonating back to the first panel, I think find some comfort in broad brushing things, which is really never a good idea. So I think there's all kinds of reasons why people volunteer, and they're all basically really good. But I think what Krista said and what the first panel said, purpose is really important. People being able to have purpose in their lives. So we should never forget that. And when you have something that everyone has, and that's a story, no matter who you are, your ethnicity, your age, your zip code, your education, doesn't matter. Everybody has a story. And so we, as different as we are, we have that common thread, and that's really consequential. So we can find, create, embrace activities that create purpose. Just three really quick examples. So there's a person who, for over 10 years, wanted a purpose, didn't really want the social aspect of things. So this particular volunteer, over 10 years, keyed in 194,000 obituary abstracts from the Evangelical Messenger, a century's worth of obituary abstracts. Those are posted online for free. It gave her purpose. I'm doing something. Was there a family connection? Was there a story there? Yeah. Her father was a minister in that particular denomination. So it was like a dual purpose for her. And no, she didn't interact with people. Another volunteer who's been with us for more than 20 years and has scanned 20,000 images of Fort Wayne Allen County fires, pre-fire, fire, and post-fire, a retired fire person. Fire people are like a brotherhood, brotherhood, sisterhood. They love what they do. They love their communities. He likes coming in to get social interaction with other volunteers, with the staff, and he loves preserving his history, remembering those stories. He has a purpose. Every month at least, he's at a breakfast at a retired fireman's funeral, connecting, showing, sharing. So he has a real purpose. The third example, Matt, I'd like to give is we've been fortunate for well over a decade to have a very large complement, not as large as your complement, but 8 to a dozen family search missionaries that do scanning work in in our materials processing unit at the Allen County Public Library. I have to admit, scanning rates amongst two of the three most boring things to do on planet Earth. So here these senior missionaries, really talented people, are taking time and treasure to come across the country to the great bustling metropolis of Fort Wayne, Indiana, from all kinds of other wonderful, exciting places. And it's amazing. It's amazing that they embrace that this really boring activity is doing so many things at so many levels. It's giving them purpose, but also a connection with others who value story, with others who value family. Not that long ago, as the leadership of Family Search for the missionaries has changed a little bit, so new people have been coming in to meet these scanning, digitizing missionaries. And, every time they talk about this really boring work they do, it's so exciting. And I was so impressed most recently when one of the missionaries, she teared up and she said, there's all kinds of things in these records. And she goes, don't get mad at me, but every once in a while I pause and I read some of the pages that I'm scanning. And she said, I'm holding people's lives and their stories in my hands and I'm making them available. And we would do it anyway. It's not a burden at all, but every time, and it happened again yesterday afternoon, when a missionary couple ends their term of service, and I think the missionaries that ended their term yesterday were with us for 18 months. So 18 months of doing this most boring task on planet Earth. They were so proud and felt good about the purpose that they had in their lives. And we make sure when they leave that not only do they have little mementos from the Allen County Public Library, so they remember us and say what a wonderful, exciting time it is to scan things, but we let them know again from us at least one more time that you did work that touches people's lives for as close to forever as any of us are going to get. So really super boring, but we don't say that. Super meaningful because it is. So, and there are more stories than that. But yes, I think purpose is really, really consequential in aging well and continuing our lives well.
Thank you, Kurt. We're going to switch gears quickly from purpose to technology, and that's a big leap for some of us in our minds. But before we do that, I'm just going to note, because I may not have enough time on the agenda to get to this, but I have a whole section here on storytelling. And the first question is for Kurt. I think he just told us a story and why we realize, why Kurt is one of the people I always think about when I think about storytelling in the family history community, because he can tell a story. The emotion that came across in those comments was really amazing. So, Kurt, thank you. All right, I'm going to switch over to Krista and Ellen for a second. So, in preparing for today's panel, several of you had noted the fact that there is early adoption for technology within this community. The two most talked about right now are early adoption of DNA as a technology and as a field or background in our field, or an area of study within our field, now AI. Krista did a webinar for NGS, I think it was last year, maybe a year and a half ago. Single biggest viewed webinar on our YouTube channel at 27,000 views when she was talking about DNA. So I'm going to just ask you, Krista, in thinking through your experiences in teaching about Ancestry's technology or teaching about DNA, what is it that you think in terms of people's early adoption of these concepts comes across, and how do you think about that as you teach?
Yeah. It's interesting, as David was talking about PAF coming out in 1984, I was 11. That summer, my dad sent me to computer camp.
Nice.
Which for a girl in the 80s, there was two of us. And when I got home from that 2-week camp that summer, my dad had bought a brand new shiny Compact 64 computer. He had loaded PATH on it. And he said, now that you know how to use this thing, I need you to take all this box of family history stuff and I need you to put that all in there. And so, yeah. And so every Sunday for most of my high school career, I would sit at that desk with my father at the computer next to me, and I would do that data entry. But one of the things that happened in the process was I was teaching him not just how to digitize family history, but how to use the computer. And he embraced it immediately. Now, as a young father, that's not that big of a deal. But a few years ago, he was facing retirement and not looking forward to it because he wasn't sure what he was going to do with his time. And I had him take a DNA test. And for an accountant whose brain works in math and numbers, he embraced DNA immediately because he could see exactly how it worked. And so 8.5 years ago, he asked me, he said, I'm going to be retiring in a few years. Could we just start now? Every Sunday, will you just sit with me and teach me how to do DNA? And so I learned how to teach DNA because I do it every Sunday night with my dad. And every new technology advancement, every new AI tool, every new little, tool we give people to improve their DNA discovery experience at Ancestry, I teach it to my dad before I teach it to anybody else. And through doing that, I've learned, I think, how to do that better. But it's been fascinating to me to watch this man who was an accountant as a profession, who used to do crossword puzzles with his own father, now approach the puzzle of DNA and be so willing to embrace that technology because it gives him purpose. It gives him a connection with me and with all the other family members that we reach out to. And it really gave him the courage ultimately, and this might sound fanatical or fantastical, to retire. He just turned 75. He wasn't he kept putting it off and putting it off. And he finally retired 1.5 years ago because he was just oh, now I have things I can fill my time with. And so, it's just been fascinating to watch his journey and then to use that as I approach not just the education that I do in the family history space, but also the way that I help as I consult with the product managers at Ancestry and the way that we're developing those products and advancing that technology as well.
Thank you. Ellen, similar question for you. So just thinking about your company as a tech story, right? It's not only a story of the technology that you and your partner have created, but it's also a story of your commitment to healthy aging. You're doing some work like Rick, original research in the aging community, and we'll come back to that in a moment. But just tell us about, as you've built your business and you think about how older adults adapt or adopt new technology or new tech tools. Can you share a little bit about your thoughts on that aspect of what you're doing with the company, but then segue a little bit into the research that you're doing with Boston University?
Sure, delighted. I asked one of our Artifacts community members, she's 76, and she is our top artifactor. She surpassed me by 300 artifacts. She's in the 700s of artifacts. And I said, it'd be really great if you could tell people what it is to create artifacts, because a lot of people can be intimidated by any new process, right? Any of us, any age, right? It's just, you have to learn it again. And she looked at me, we were on a Zoom, and she's like, Ellen, it's just not that hard. And I was like, okay, so let's explore that. But, we had a really great thing happen. The day we launched our company, we're just afraid of making the internet explode or something. What do 2 former CIA analysts have to do with deploying a technology product on the world? And we, that same day, pitched to the AARP Age Tech Collaborative because we knew that the technology we wanted to build needed to work for you, whether you're a 16 or 100 and going. And we got in. And so what that meant for us as a company is that we had this really unique advantage of being able to sit down with the researchers at AARP at being able to talk to experts across all these different fields who are already deploying technology and ask the questions like, are we doing this right at all? I mean, I called up researcher, through that program. He had been at UC Davis. He was now at Boulder. He was the one that went to Facebook and said, you're doing it all wrong in terms of memorialization and legacy. Let's fix it. Right. So I just called him up and I'm like, hey, I'm building this product. I'd love to know if this is going to resonate and work for all aging populations. And, if you're not aging, you're dead. So we're all there. So that was kind of how we looked at it. And sure enough, our earliest and most fervent adopters were originally in 65 to 80 age bracket. And we are, I don't know if you know the story of the guys that created Airbnb. But they literally went to every house and took the pictures themselves and wrote the descriptions because that was how they would know their product is going to work and is going to resonate, right? So we kind of took that approach and we knew our earliest adopters and we got a lot of feedback that was really interesting because the way we've built our company, I tell people it's as easy as social media, but all the social media giants were on Capitol Hill defending themselves. So we stripped out all of the view counts and the follow counts and the commentary and emojis. Well, we kept asking our members, how do you feel not having emojis in your world? Things like that. And if you're paying attention to how people want to connect and how lonely they can feel, when your members tell you, please don't let my daughter heart that artifact and move on with her day, it gets real. And this woman shared a story and she said, Ellen, I share every artifact I make with my daughter, and 9 times out of 10, the phone rings. And she's like, seriously, Aunt Gertrude's fur hat? Like, no, I do not want this. I don't care how great the story is. Or, are you kidding? I didn't know great grandpa served in World War II. Like, how did no one tell me? And that's the warning to storytellers that we'll get to. Did you tell it? Did you tell it more than once? Were they listening? Were they ready to hear it? Right? And so I think that that's a little bit of an insight into how we built tech, looking at it for all ages.
Fantastic. You want to talk a little bit about the BU?
Oh, I totally forgot about that. Okay, yes, we are working right now actively. We're recruiting round 3 of volunteers. Anyone 65 plus, give me a call. We are working with UMass Chan Medical School out of Boston. Now, when we first thought about doing our research, it's because people within the dementia community and their caregivers were coming to us with anecdotal information. We create artifacts together. We share stories. We have a better day. They're more compliant. They're having less instances of, if you've ever dealt with someone at sundowning, right? That these moments are going better. So we had this idea anecdotally that doing something joyful, like Rick talked about reminiscence therapy, photos can be joyful, right? You have to choose the right photos. But we had this idea. We also had the idea that we wanted to fundamentally shift the conversation from what can we do retroactively to what can we do proactively. So our research, because when you create an artifact, which can combine photo, video, audio to tell the story behind objects in your life, we are now looking at the biomarkers in your voice to detect cognitive health. And cognitive health changes. So our study participants create 5 artifacts. They have their voice in each one. They submit it to this, and they're redesigning the machine learning model to use this voice. So what if you could scan your voice at 30, 35, 40, and you could have a screening anytime, anywhere? This is how we get up to 40% decline in diagnoses, is if we can get ahead of it with lifestyle changes, with hearing aids, with addressing sleep apnea. So that's what we're trying to do, is get ahead of it with our technology and be able to use the biomarkers in our own voice and flip that script and, have Seth Rogen on Artifacts tell you, hey, looking sharp, or like, go talk to your doctor. Seriously.
I have a lot of storytellers on my panel. So we're going to switch gears a little bit and start to think about, and I do want to come back to storytelling, but I do want to begin to think about this segue that Ellen's starting to make here, from the kinds of activities we do to starting to frame these activities in the context of healthy aging. And so the question for each of you, we'll just go down the panel in order, is to think about, in maybe a sentence or a minute, how can we as a family history community frame the programs we do in terms of measurable outcomes for people as they're aging. So whether it's mental stimulation, physical activity or movement, social interaction, how can we frame our activities? And in part, going back to, I think something, I guess it was Sherry mentioned, how insurers are beginning to look at these activities in the context of reducing their overall cost exposure. If we can think about how, as a family history community, we can effectively communicate the work we do as a benefit to healthy aging, that could be a winner for us as a community. So, David, thoughts first, then we'll move our way down the panel.
Yeah, it's a really interesting question because everybody quantifies things differently, obviously. When I think about programs, though, that we can put in place, our ability to preserve institutional memory of those who are aging is at the top of my list. If we have to understand that the largest genealogical asset on the planet is living memory. If we could just capture living memory today of every human being, we would have the largest genealogical asset and database out there. What I have observed over the years, interestingly, and I've heard other people express this, is that you have grandparents who are more than willing to share stories with grandchildren that they won't share with their own children. And so if you are the child of aging parents, you need to drag your kids with you and get the kids to engage them while you sit there and take copious notes or a recording device or something, because whatever it is, this connection between parents and grandparents is phenomenal. And I think we underutilize that ability for grandchildren to reach. And I think part of that is tied up in that generation wanting to leave a legacy, and that their descendants will understand what they saw and what they experienced. As a person who was raised by old people, I'm not kidding. I was adopted. Three of my four parents were born in 1912. It was just always old people, and I was a single child. You know, I was in a house with old people all the time. And my mother was a storyteller, and you know, it was how information was passed, and it was how you understood what was going on. This past week, I was given access to a signature book that went back into the 1900s. And some into the 1800s. But the ones in the 1900s, what was interesting is it was from an area of the country that I was very familiar with in Arizona. And I'm opening up this signature book, and I recognized half the names in this book because of the stories that my mother had told and the names that I knew all along from those areas. And, you know, some of these people had been dead for at least 60, 70 years, but I knew their names and I knew where they were from. So I just think there's an opportunity waiting for us if we can figure out how to capture that from the present generation.
Agreed.
Debbie, thoughts on how to communicate what we do?
Yeah, so one of the things that we do, we often have people who come into the library, they don't know they're coming, they're just on Salt Lake on vacation or whatever it may be.
Double parked.
They're on their way between Zion and Yosemite, and they stop in. And they don't have a lot of information with them. And one of the first things we do is, have you called mom? Have you called dad? Have you called grandma or grandpa? And it's so much fun to see them get on the phone and they're getting all this information. And at the same time, you can hear, if their phones are not loud enough, grandma or grandpa telling the story behind that. And they're mostly interested in the names, but they're also listening to the stories. And so that's one of the ways that we kind of encourage that in the library. But I have found, as my parents have aged, that they are more interested now in sharing their stories than they had been when I was growing up. I have heard very little about my mom. She lost her dad when she was a teenager. I had never heard her talk about him. But as she is getting older and I'm spending more time with her, she is opening up and she's telling me these stories. And so I'm writing them down. One of the things that I have done, my daughter did this for my mom, but for my dad, I sent him one of those subscriptions, where they get an email each week where they tell a story. And at first, some of his answers were just like, one line or a couple of words. And it was like, come on, Dad, can't you tell me more? And as he got more and more into it, it got more and more defined. And I took great pleasure last fall in giving him his book that we'd put together. And I'd gone online and I'd found pictures of the things that he described and added that. And he just was so thrilled. And I sent it to all of his grandchildren. And so getting them to tell their stories, whether it's using this kind of technology or sitting there and recording it on the phone, we've got to tap into that. I agree with David. It's the greatest resource that's out there. Going back a few years, when I was my first year of college, I lived in the town with one grandmother, and another grandmother lived about 10 minutes away. And the other grandmother I knew very little about. Nobody in her family had done family history that I knew of. So I went over to her house one day with my big yellow legal pad, and I've still got it. And I started taking notes. And she told me all of these things and who belonged to who and who was who. She even showed me pictures. Unfortunately, we didn't have cell phones then, so I didn't get copies of any of those pictures. But it was great. Fast forward, I get married. I have a young family. What am I going to do? I can't do any family history at that time. As I've gotten older and gotten into it, all of those things that she's told me has been true. And I've captured that because she's not here anymore to give it to me. So we've got to act now. We've got to do those types of things. We've got to figure out how our parents and grandparents best relate to us. If they get nervous because you have the cell phone out, just slip it on your lap so that they don't see it and do that recording that way. But get them to talk because they want to. And a lot of times once they start talking, then they want to start finding out more information. I did that with my stepmom, and now she's just like, hey, are we related to this person? I need to know. And so, yeah, they're ready to tell us. We've just got to act on it.
Debbie, if you need to get additional tips on how to hide your recorder from a parent who might not want to see it, you might want to see Ellen after the show. You did all hear that reference she made earlier.
I did find out recently my son-in-law is retired CIA, so something I didn't know until he retired.
Kurt, thoughts on how we frame this out?
So taking just a slightly different approach, a lot of wisdom continues to be shared here today. So many different things, and they all do kind of connect. So number one, the power of partnership. So we can tell a better story, and we can get more traction and more ears and more eyes on our story if we partner. And who is we? The short answer is yes. Everyone, every time you can. We have extremely, and I hope I'm not jinxing anything, really extremely good success working with every elder care facility in Northeast Indiana that will have us. No matter what we do, the residents embrace it, the activity directors embrace it, and how can we have more? So we try to continue to engage in proactive conversations about, tell us what you as activity directors believe your residents, whom we hope you know better than we do, would really appreciate. I think we need to be more intentional about gathering metrics and more intentional about collaborating and cooperating with academia, who's doing a lot of studying, so that we can tell a fuller and a richer story. I believe in, and maybe this is only librarians and archivists that do this, but I'm kind of thinking maybe not. We're really intent on, hey, look at this. We made this just for you. This is so awesome, isn't it? Nice little thing on the front here and paper and colors. This is really cool, isn't it? And of course, a question like that begs the answer. Well, yeah, it's really cool. Most often, and again, I see it in my profession, librarians, archivists, information professionals, we do what we think is really the best thing. And what's the component that's missing? We don't listen. Listen to the elder care specialists. listen to Dr. Ye, listen to people in the space that we can benefit from, listen to their knowledge, their experience, etc. And I think we can do better work. We can touch more lives. And to your question, Matt, if I think I'm hearing the core of the question, how can we gather better metrics and tell a better story about the intersection of family history and story to aging well, to continually have purpose in our family members' lives? And even as we may have made as individuals mistakes, if we can call them that, unintentional mistakes in caring for our family members, like I mentioned a couple minutes ago, gosh, I wish I would have known like 4 or 5 years ago what I heard last hour. But we can still do things today, even if someone, a person on the dementia path, like my mother, that doesn't really check many of the, I hate to use this word, but normal boxes. There's still a lot of things that if we're intentional about listening and partnering and finding out what's going on in the space, that will benefit us. I think that family history, family story, and aging well are like this. So yeah, the best way I think to do that is to partner, to listen, and not necessarily think we have to come up with the answer, but can we share our experiences so collectively we can come up with a better path? Like my colleagues, they hear this way too often, but since you aren't with me every day, I can say this. I tell my colleagues all the time, we don't do magic. We work intentionally, we work with purpose, and we work intelligently, but we don't do magic. But to make a lot of progress, since we don't believe in magic, is we need to partner and we need to listen to people in the space, people who have the experience, and collectively we'll do a lot better.
Good. Well, to stay on time, we're going to give Krista and Ellen 1 minute each to answer the same question, even though we know they both can do as long as they wanted on this topic. But Krista, just thinking about it as the great communicator in the genealogy space, how would you communicate what we do to, you've done it for your board at Ancestry. How would you do it for an insurance company? How would you do it for a finance company? How would you pitch what we do as a value to the economy and to society?
Yeah, there's two things I'll share. I could share a lot more. We have this joke around the Ancestry office that if you ask a genealogist what time it is, they'll tell you how to build a clock. And we've got to stop telling people how to build clocks because they don't care. They just want to know what time it is. Mm-hmm. The other thing is a research study that Ancestry commissioned back in 2023 that said that more than 80% of adults, we surveyed senior adults, that more than 80% of adults would share their family stories if they were just asked. Mm-hmm. And so when you think about how those two things go hand in hand and kind of frame it in this topic, like we need to do more asking of our elders for their questions. And when they do tell us how to build a clock, we need to be okay with that. And then sometimes maybe learn how to redirect or maybe gain those skills now so that when we are the elders, we're not telling people how to build clocks.
Ellen, your thoughts. You mentioned earlier you pitched the product to AARP. Rick's done the same thing in the aging sector and sharing his thoughts. What's your thought about how we frame what we do as a family history community?
As a family history, I think we tell them that we improve the quality of life for those living with dementia and their caregivers. It's that simple. Conversation. I tell people that storytelling and story sharing are important aspects of social function, and conversation itself is a creative art. Creative arts for the brain improve resiliency. They reduce apathy. They reduce isolation. That is about quality of life improvement. And when my father tells me, I ask your mom, what is this thing in a day? And she goes off. She's my best friend again. I am no longer her caregiver. This is about quality of life.
Thank you. Well, we're going to open it up to questions now. And again, if you have a question, if you could head your way over towards Andrew and the microphone, and then Kate's going to check and see if there are any questions online for us. And if you don't stand up for questions, I'm going to ask you all to stand up and point some of you out. Go ahead, Suzanne Hoffman.
All right. I'm another storyteller. So one of the things about asking your relatives and they're Jewish, you will get, no, there's nothing to report. So there's a challenge there where you've got a mental block, you've got a historical element to the less resilient willingness to share. But also, I want to take all of us to task. What we do as genealogists is document the stories. We give the facts to the artifacts, the facts to the story itself, and memorialize it. That takes advocacy, because right now our industry is in peril because we are not gaining access to the records that we need. And we need to take these stories and this telling and take it to the government, not only at the federal level, but the state level, the local levels. That the access to records is extraordinarily important to the well-being of our entire population.
It's a great way to frame it as well. Absolutely. So says my colleague on the Records Preservation and Access Coalition, and one of the funders of Family History Hill Day, and the president of the Association of Professional Genealogists. All right. Thank you, Suzanne.
Can I just
Go ahead, Chris.
I've done a lot of work in the Jewish community. I know exactly what you're talking about, but I will tell you the fastest way to get many of our elders, including in the Jewish community, to tell their stories is to present them with wrong facts. Tell the story wrong. I tell the story wrong, and all of a sudden they want to correct me.
That and food helps. Jewish community.
That also works for World War II veterans and their children who are still alive.
Kate, you have some questions from online.
I have one, and this may actually be for the previous panel, but I thought if any of you have anything, I'll go ahead and ask you. We had someone ask if there are any research citations or studies that we can point people to related to the topic we're talking about today and how this supports healthy aging.
Ellen, Krista, you want to start?
I don't know where we'll put these resources, but there's absolutely research in areas that I've looked at recently is like digital technology and family history and stories. There's absolutely been research done. And then obviously there's the reminiscence therapy. There's multiple entities doing some of that as well.
Yep.
And if I can jump in, I believe that Rick Voigt and the Vivid Pics team is working with SLAM, Societies, Libraries, Archives, and Museums to try to come up with a list, a fairly contemporary list of actually those exact things, studies. And there's a lot out there. I engaged a couple of people to do just a quick literature search, and we're like, phew. So go through those, see which ones are the most consequential for what we'd like to do right now, the story we'd like to tell. But yeah, there's a lot out there. Yeah.
And if I could then answer part of that. So if you go to vivid-pix.com/reminisce, you will be able to read the published article that we did within 4 memory care facilities with Certus Institute, which is the benefits of photoreminiscence therapy. And then Kurt, thank you. We do welcome pulling together the family history community and the aging community for more research.
And that's an important point. Part of one of the findings that we would expect to come out of a session like this is where are those gaps? One of the invitees we'd talked to about potentially coming out for the earlier panel, Julianne Holt-Lundstad, did I get that right? Who's at BYU, has done some really exceptional work on the role of how physical activity can improve and some of the issues we've been talking about, isolation and memory care and things like that. But she has recognized that there's a gap between her work with movement and physical activity and the mental activity kind of work that we do in our field. So there are some gaps that she has mentioned to us that Ed's aware of, and that will include in the findings and recommendations. Thank you.
Thank you.
Sonny?
So I'm curious about how this panel might respond to my observations that I think at our conferences and things, I wonder why StoryCorps isn't there. I wonder why we don't have booths set up to capture people's stories on the spot. And then I think, well, because 10 of the 15 people who would walk by would feel accosted. I'm like, well, no, I can't tell that story right now. I don't have the perfect version down yet. I don't have my notes with me. I'm not ready to tell that story perfectly. So I'm not ready to go into that StoryCorps booth. And so the opportunity in pursuit of perfection that never comes, the opportunity is lost. And on the other hand, I also see a reluctance really to embrace any education on how to be a good interviewer. So I noticed Krista referring to that as like, we need to sometimes ask better questions. We need to give a better environment for people who are trying to tell their stories, but maybe are not gifted storytellers. But I've noticed as a genealogy educator, I've noticed a hesitation to really embrace any kind of education on how to ask good questions.
This is coming from the new editor of NGS Magazine, by the way. So if you're going to write for Sunny, you have to ask good questions. But go ahead.
So
It's not just about asking the interviewer asking the good questions. It's about how to be an engaged listener.
Absolutely.
Because you sure better not be the one doing the majority of the talking in this. Sorry.
No, I totally embrace that. I just wanted to acknowledge and thank you, Sunny, for your question/comment. We don't do enough. And if I can just take one step quickly, Matt, sort of out of bounds, as genealogists, are we really researchers or are we hunters and gatherers? I can tell you from the cubic feet of manuscripts that pour into our library every week from professional genealogy, however you want to define that, I don't care. They gather a lot of stuff. They don't do any analyzation that is in evidence, likely, David, in their mind, in the living memory. And it's not organized for anyone else except themselves. But to your point, Sunny, I have watched, observed, listened to so many videotape interviews and live interviews where who becomes the prominent person in the interaction? The interviewer. And no, that's not the point. When the interviewer is talking over the interviewee, correcting the interviewee, and telling the interviewee, oh, I know exactly what you're talking about. No, you don't. Everyone's experience is unique. I just lost a dear family member. I know exactly what you mean. No, you don't, because you didn't lose that family member and that person wasn't important to you. You may have had a similar experience, but oh my goodness, I think all of us have observed a good number, I dare say the majority of interviews that just go off the rails really quickly. And we're not accomplishing our purpose. And our purpose, I think, is multi-layered. Our purpose is to get the story, to get the information, to honor the person by our interest, and to honor them by not telling our story guised as their story, but honoring them by letting them tell their story. So, oh my goodness. Oh, yes. The training, practice, StoryCorps.
That's my other button I want to push on in just a little bit. Anybody seen any evidence or tried something like that where you have story gathering experiences at a conference? Did it work? Did it fall flat? If it fell flat, why?
So I've seen it at Leading Age. So Jack York, he did a story capturing session. He had this RV thing that he travels in. And they actually were doing an active session. They announced it in advance. People knew. And then they came in and they had to sign up. And it did work really well. You'd have to ask him about that. We are actually doing it. We just did it for the first time. We're doing it again at the National Association of Senior and Specialty Move Managers. Here's the difference though. What you talk about is absolutely right. Having that perfect story and being felt like you're on the spot, A, is advance notice, but B, when we ask people about their stories, the fastest way to diffuse it is to just ask them for something true. What is it? Oh, it's a cat. Okay, why do you have a cat? Right? I think sometimes we just aren't comfortable enough as the interviewer to ask the questions that will lead them down that path. But if they get too emotional or they feel like they're on the defense, or what we're told all the time is when a genealogist or historian asks the question, they think there's a right answer. And that becomes a stumbling block. And that is something that I'm not sure if people talk enough about.
Yeah, so I promise I'll be quiet in just a second. So at one of the Federation of Genealogical Society conferences in Fort Wayne, we were able to coordinate with our PBS local station to get StoryCorps there for part of the conference. They couldn't accommodate all the people who wanted to be a part of it. That they had a waiting list, and finally it was like, this is the waiting list, here's the second waiting list, and we're never going to get to any of these people on the waiting list. I mean, it was just full. Love what you just said. And I don't mean this to sound critical. I'm just relating my experience. Sometimes in the oral history field, and that's we in the Genealogy Center for Wayne almost never call it oral history because it has too much, sorry, Dr. Ye, too much of an academic slant to it. So if you still read today about you want to go interview someone, well, take 6 months and research their life and write the right question and do their bio and vet their bio and publish it and collaborate. And the person could die twice and you're still trying to figure out what the right question. I love that approach.
Well,
Start basic. And so a couple of people, well, if I'm honest, actually, I'd probably say more than a couple of people have been turned off by our Life Stories program in the Allen County Public Library. It's really fledgling, but they come expecting that they're going to participate in months of research about a celebrity that they're going to interview or about a family member that they're going to interview. And it's like, we point them to, and it's intentional, and that's the snarky side of Kurt coming out. We point them to all these universities that have miles and miles and miles and screens and screens and screens of questions and say, pick your question, pick your dozen questions. It's, sometimes, more than sometimes, we let perfection get in the way of progress. And we're so strident about the perfection, there's no progress being made. And we lose that living memory. We lose the living memory. Mm-hmm. Oh my goodness, when someone dies, part of the longing for me is, I wonder what died with them, particularly when it's a family member. Like, what piece of my story, our story, did they take with them? And what's my responsibility in that?
You should be passionate about
Time
that.
for a story.
We actually, at the risk of being a bad interviewer, I will tell you we are now 3 minutes over the time that that Ed and Rick gave me. So we will pause there. But Debbie, you're with us for the next several days, so we will get the story from you. Couple of announcements before we break. So Rick and Chris Thompson, who's in the back filming, they will be at the Vivid Pics booth doing exactly what we were just talking about, which is interviewing, but they're going to be asking 3 questions, which are written on the bottom of that board over there with the 3 logos on it. So be prepared to come and tell that story, Debbie, on camera, because Rick and Chris can splice that into the conversation here. So you still have an opportunity to tell the story. Kurt, you're not invited. Second announcement.
Not the first time.
Second announcement is the symposium is going to be transcribed and it will be made available to all of you. Obviously, we're also filming and there is some post-production work that will need to be done, but expect to see that on the NGS YouTube channel, on the Family Search channels, and on Vivid Pics channels as well. So we're going to take a 15-minute break, grab some more refreshments, and then we'll be back with panel 3 and then our Q&A after that. So thank you, everybody.